With Medicare, there are three main time frames someone can enroll. Can you explain that?
Yeah, your initial enrollment period. For a lot of folks, that's when you turn 65. For some folks, if you go on a Social Security disability, after 2 years of being on Social Security disability, you'll be put right onto Medicare, so you could be under 65 and have Medicare. Those are considered initial enrollment period times. The second opportunity for somebody to enroll into Medicare would be during the open enrollment period, and that's from January 1st till March 31st. And the third time would be a special enrollment period. So for that, the majority of people, if at 65 you were employed or your spouse was employed and you have group insurance from that employer, and there's more than 20 employees, all right, once you're deciding to come off that, whether you're retired and you're saying, look, this group insurance is expensive, I want to go on Medicare, that's your special enrollment period. At that point, you'll be able to get onto Medicare.
Okay. So for someone starting Medicare, one of the most important things that they may need is eligibility verification.
Yeah. Let me explain this first. So if you're in your initial enrollment period, you don't need to let the insurance company know that you had drug coverage. Okay? But if you delayed because of working or spouse working and you're on group insurance, and let's say you're 67 and you go into Medicare Part B, no penalties to do that because you were on that company's group insurance, all right? But whenever you enroll into the Part D plan or Part C Medicare Advantage plan, that insurance carrier is going to want to know what drug coverage you have. Now, that happens after your enrollment into the plan. You're going to receive a letter. If you don't notify them, you're going to get a penalty, because they don't know that you had Part D drugs. Even if, obviously you got Part B, there was a special enrollment, you went through this with Social Security and you told them you had this group insurance, the insurance carrier doesn't know that. They want to hear from you. You could fill out the form, send it back to them, or call them. They'll take either method. We walk our clients through this all the time, but we see many people that were on Medicare that we didn't help initially, and they're paying these penalties. And at that point, we got to contact Center for Medicaid Services, write a letter explaining that you did have it, and then they would review it and potentially do away with that penalty.
This is a lot of information, so people need to reach out to you to explain this.
Yeah, we want to make that process easy for them, and that's one of the things that we explain, but we get it. We're explaining a lot of things, and there's a lot to understand, so we're there for them.
Well, thank you so much, Mike, for joining us on Community Connection.
Thanks, Liz.